Hi guys, welcome back to Hygiene TV. I'm here today for us to learn on how to administer oral medication or capsules. This is my patient, Mr. Che, who is the COO of Hygiene TV. So, as you know, when it comes to administration of medication through oral, you have the things that you need, the things needed for the procedure. So these are the requirements. So first, you need to wash your hands. Then you need to make sure the patient treatment sheet is with you. Then the medication. So this is the medication that we are going to give to Mr. Che. You need your drinking cup. So this will be the cup that you're going to pour the water inside. Then there's our water. Yes. Then there's the saucer that you put the spoons on. So I'm not in a uniform, so I will be using this as my watch. So I'll be using this one to check the time and also for giving the patient. I have my napkins here. After giving the medication to the patient, I'll use it to clean the lips or where I need to clean. So stick and stay with me and let's learn together. So guys, before you start the procedure, you need to first check for the right patient. Mr. Che, abacho when I first Mr. Che. Okay. Mr. Che Mesa. Okay. Me Mr. Moji Kelvin. When I'm here Mesa and me wa man me ba be taking care of you. Now when say bia and I say abranya na the nurse for no ba be ma oju. Anti ewia de ne so aso me dey do no problem. Anti be some be bisa say akwanya bi wo say meeting dia ma wa. Okay. So guys, we are done identifying our patient and also establishing rapport with the patient. So the patient has given us the go ahead that we need to come with our medication. So let's go and bring our tray containing our equipment and everything to serve our patient. Mr. J. So guys, when you're about to give the medication to, you need to also perform hand hygiene, or you can also rub your hands with alcohol-based sanitizer. So I came with my sanitizer. It's here. Yeah. So guys, now I'm done. So when we are done, you need to first check the time. Then you take the patient treatment sheet to also confirm whether the time that you are, whether is indeed the time that you are supposed to give the medication to the patient. So now I'm checking the time to see, to confirm. So after you are done, you need to also check the medication. Yeah. Then also confirm or compare with the one on the patient treatment sheet to see whether it's indeed the medication you're supposed to give to the patient. Mr. Che, but on a hopefully comfortable self is a would say and as a mountainous man from okay, so you need to also ask the patient whether the position that he or she is in, is he comfortable to take the medication, or he or she will prefer to sit down. Yeah. So now, since the medication is tablet, which is I told you, so we came here with a saucer with a spoon on it. So we will take our medication again, then confirm from the patient treatment sheet again before. Then after we are done with that, we will pour the medication on the spoon. So when we remove the medication you need to also assess for the patient treatment sheet. Then when you also remove it like this, you will still compare with the patient treatment sheet. Yeah. Then you also pour it on the spoon for the patient. But before that, you need to check for the expiry date of the medication to see whether there is any or the medication has reached the expiry date, so that you won't give a medication which has expired to the patient. So now I'm checking for my So after done checking the expiry date, I will then put the medication on the spoon for the patient. So this is how I'm going to do it. So after that, you need to check and know the dosage, the amount that you are supposed to give to the patient. So the patient, the doctor has prescribed that you need to give 300 milligrams to the patient, but also the medication came in 150. It means you are supposed to give 2 tablets. You are supposed to give 2 tablets. So now I'm done. I've putting the medication on the spoon for the patient. So when we are done, Mr. Che, what are doing here? So if the medication the patient is supposed to swallow, the patient is supposed to also put it under the tank for you to go all this you need to also let the patient know. So you see this one, the patient is going to swallow the medication. So I'll pour my water. I'll pour my water here. So you put the water to here on the lid. Then you give the medication to the patient. So after the patient is done, you will give the patient water. So the patient will take the next medication. So I'll follow the same procedure. So I'll do the checking again. I'll check for the expiry date. Then check the dosage again. Then put it on the lid for the patient. It's actually also after I do this work. Then you give the patient water again. So after that, you need to make sure you chart the medication, the time that you give the medication to the patient. Then you need to stay with the patient for about 5 minutes to observe whether there's going to be any side effect, adverse reaction, or anything. Then you need to also explain to the procedure. You need to also explain to the patient some of the adverse effect or some of the side effect that can come with the medication. To be such I do we are one on bit me why I'm crack, bit me be a phone crack, but you be a drone and use on kakra one. And this me down chain crack.